So I'm going to walk in the patient's room, wash my hands. Hi, my name is Francis. I'm going to be your RN today. Can you verify your name and date of birth? And then I check the wristband. And so today you're going to be getting an IV line. That's what the doctor ordered for you. Do you have any allergies? Do you know if you're allergic to betadine? Okay. So I'm going to go get the supplies and I'll be right back. So I'm back with the supplies. Can you verify your name and date of birth? Okay. So this should only take about 5 to 10 minutes. If you have any questions, you can just ask me during the procedure, or if it hurts, just let me know and I'll stop. So I'm going to wash my hands again. Put on the gloves. Then I have to prime the extension to get rid of any air bubbles. So I'm going to take this thing off. I'm going to prime and then just going to make sure it runs through. Okay. So that's primed. Set it down, make sure not to contaminate it. So I'm going to feel for a vein. Okay, so I feel one right here on the forearm. And then I'm going to use a 22 gauge. If you were to administer or take out more thicker liquids, then you do a smaller gauge, such as an 18. So I'm going to bring my supplies over there. Okay. Needle. So I'm going to wipe the area that I want to inject or put the IV in to out. Be sure not to contaminate and then throw that away. Then I'm going to apply the tourniquet. We're going to get our needle out, bevel up, and then look for the vein because it should be engorged. And we're going to inject, and we have flash. So I'm going to advance the catheter. Okay. I'm going to hold it down. Going to connect this and then flush, and if it feels cool then I'm in the vein, and if it hurts then I'm not. So I'm going to go ahead and occlude this. Okay, take this off. And I would have warned the patient about the stick, just to warn them in case it hurts, and then I'm going to release the tourniquet so it doesn't spew out. Then I'm just going to take down the catheter just in case, or to make sure it doesn't come undone or come out. So we're going to place tape right here. I'm going to go under the catheter. And I don't really want to put tape over the catheter area so I can see if it's getting inflamed or infected. So I'm just going to keep on securing this down. And I can keep adding tape, but it looks pretty secure to me. And then I'm going to put Tegaderm over it, over the actual injection, so we can keep an eye on it. And then there's an area right here that says date and initials, and you'd put the gauge needle you used your initials and the date so the next nurse could look at it and observe it or know what stuff to use. And we take this off. Okay. So, are you feeling okay? So I'm gonna put this in the sharps and discard everything that's used. So if you have any questions, just ring the call light and I'll be right in if you need anything. So I'm back, and now you have an order to take out the IV. I bet you're so excited. So can you verify your name and date of birth for me? Okay. You're still not allergic to betadine or anything else, right? Okay, that's good. So I'm just gonna take it out. It should be quick and simple. Let me know if it hurts and I'll stop. So with Tegaderm, you wanna pull. Make sure you're not hurting the patient's skin when you're taking it off. Okay, and then I'm just gonna take it on the count of 3. 1, 2, 3. And then you declude just in case there's any bleeding and we could put a Band-Aid over it. So do you have any questions for me? Okay, I'm gonna go document what I've done, and if you need anything, just hit the call light and I'll be right in.
Done.
Mm-hmm.